My name's Bri,
Molly, Caitlyn,
and we're doing coronary artery disease. Coronary artery disease comes under the umbrella term cardiovascular disease, being the disease of the heart and vessels. It affects 1.4 million Australians a year and kills 54 Australians each day, which is equivalent to 1 Australian every 27 minutes. 13% of deaths in 2013 were caused by this disease, and they were largely preventable through modifiable risk factors such as diet, smoking, and exercise.
Todd Francis is a 76-year-old male. He weighs 83 kilos. He has tightness in his chest associated with pain on exertion. His pain has been constant for 24 hours. He doesn't exercise regularly, has a poor diet, he's a heavy drinker and a social smoker. He experiences short of breath when walking a few metres from the ambulance to the hospital bed and regularly has to stop mid-sentences to catch his breath. His current conditions are type 2 diabetes, hypertension, hyperlipidemia. His current medications are metformin for his diabetes. Family history: his father died at the age of 73 due to a myocardial infarction, and his older sister suffered from angina pectoris. His social history: he's married and lives at home with his wife, has 4 children. His symptoms, which he presented with, was a productive cough, chest pain, discomfort, tachycardia, dizziness, breathlessness, cold extremities, and clammy skin.
Coronary artery disease occurs when the epicardial coronary arteries that supply blood to the heart become hardened and narrowed by plaque. Atherosclerosis is the plaque, which is mainly low-density lipoproteins which build up in the artery wall. When the plaque ruptures, clotting of the artery occurs. And if it's a subtotal coronary occlusion, it causes acute coronary syndrome. And this can be either an ST segment elevation, myocardial infarction, or unstable angina. If there's a complete coronary occlusion, the myocardial muscle is injured and this will develop into myocardial infarction. The narrowing of the lumen is what impairs blood flow to the heart and may be asymptomatic or symptomatic and can occur at rest or on exertion. Normally a patient seeks medical attention when they experience their first acute symptomatic episode, but they may have experienced weakness, shortness of breath, dizziness, nausea or vomiting. These are the common signs and symptoms associated with coronary artery disease.
The difference between normal and dysfunctional state of coronary artery disease. In terms of the coronary arteries in a healthy heart and the way in which they function in an individual who displays no evidence of coronary artery disease, they primarily deliver a continuous supply of oxygen and nutrients to the myocardium. When discussing coronary blood flow, it is crucial that there is a basic level of understanding regarding oxygen delivery and the balance between oxygen supply and demand. During the cardiac cycle, the contracting and relaxing heart muscle influences its blood supply by changing pressure in the aorta, which is the main artery of the body and is rich in oxygenated blood. In order for the heart to function, the myocardium requires a significant amount of oxygen, hence why it's tightly connected to blood flow. During periods of physical activity or stress such as anxiety, the cardiac arteries adjust and dilate to increase the flow of blood, which is regulated via autoregulation. When discussing coronary artery disease, it's important to know that it's a manifestation of atherosclerosis. This is due to well-known risk factors such as high blood pressure, high cholesterol, smoking, diabetes, and genetics. The slow progression of coronary atherosclerosis leads to the gradual thickening of the inner layer of coronary arteries due to the development of a plaque, which is essentially a waxy substance. The presence of these plaques narrow the lumen and can cause blood clots, which can consequently obstruct blood flow to the heart, brain, or lower extremities. Many of these plaques remain asymptomatic, but the ones that occlude the arteries, which in turn hinders the flow of oxygen-rich blood, causes complications in terms of angina and myocardial ischemia.
Coronary artery disease potential complications are life-threatening if left untreated. If Todd didn't turn up to emergency and ignore his pain, the most likely complication would be a myocardial infarction and more than likely death. Meanwhile, an Australian study reminds us that myocardial infarction is but one of several manifestations of the cardiovascular disease. The complication is that Todd has a formation of atherosclerosis plaque in his coronary circulation. This plaque build-up can limit his blood supply to the heart due to the plaque blocking his vessels of the blood to pass through. However, in a worst-case scenario, Todd's plaque could rupture. When this occurs, underlying tissue of the vessel walls are exposed, resulting in platelet adhesion and thrombus formation. This would be a major complication for Todd. If this blood clotting occurs on his cardiac vessel walls, the clot will grow and eventually cut off the supply of blood to his heart muscle. This will result in acute myocardial ischemia, and if untreated quickly and the obstruction is not removed, infarction will occur and slowly Todd's heart muscles will die due to hypoxia of the muscle cells on his heart.
The first drug we've chosen is furosemide, as it's a loop diuretic and it inhibits sodium reabsorption. Where sodium goes, so does water, and it therefore causes less water to be reabsorbed into the body. It's an antihypertensive as it decreases edema and intravascular volume. The heart doesn't have to work as hard to pump the blood around the body, therefore lowering Todd's BP. The indication for this drug is the management of hypertension. It's usually used in conjunction with other antihypertensive medications. The contraindications for using this drug is if there's a history of hypersensitivity to furosemide, if there's a fluid and electrolyte depletion state, and caution use for older adults and individuals with renal disease, as the kidneys are less able to filtrate waste products from the blood and manage with increased fluid levels. The nursing considerations is to take a baseline OBS prior to administering the medication, a postural BP, monitor urine and blood glucose, a fluid balance chart to accurately measure input and output as to not cause dehydration, a BP prior to administering furosemide, as if it's low, then you would withhold the drug and seek clarification from a doctor. The next drug is rosuvastatin, which is an anti-hyperlipidemic. This results in reducing the amount of acid, which is a preceptor for cholesterol. It also inhibits hepatic synthesis of low-density lipoproteins. The indication for this drug is high cholesterol. The nursing considerations are to take a baseline observations prior to administering the medication and monitor CV status to monitor for myopathy, looking for pain, tenderness or weakness. Because he's a diabetic, we also need to monitor for the loss of glycemic control, which is the typical levels of blood sugar in a person with diabetes mellitus.
Glycerol trinitrate falls into the category of nitrates, which are a group of drugs that are used to relieve acute or chronic angina, along with controlling blood pressure and managing pulmonary congestion. In terms of its mechanism of action, it dilates the blood vessels and increases blood flow, which means the blood supply to the heart is enhanced and angina is relieved. This also means that the heart will receive a more sufficient supply of oxygen. By taking this medication before exercise, it allows individuals to exercise longer without chest discomfort, and as a result allows them to reintroduce physical activity into their daily life. Perindopril falls into the category of ACE inhibitors. ACE inhibitors block the conversion of angiotensin 1 to angiotensin 2, which is a powerful vasoconstrictor. By inhibiting ACE, it results in a reduced peripheral vascular resistance and therefore a decrease in blood pressure. With hypertension being a major risk factor for coronary artery disease due to accelerating the development and progression of atherosclerosis, it is essential that this patient receives medication to control these symptoms. The primary goal of treating hypertension is to lower the blood pressure, reduce cardiac ischemia, and to prevent cardiovascular events that can potentially lead to death. This particular pharmacological intervention should be actively used in conjunction with lifestyle modifications, such as incorporating regular exercise into daily routine.
Metformin. Todd has many contributing factors which can exacerbate his coronary artery disease. One major factor is his type 2 diabetes. If Todd doesn't carefully manage his diabetes with appropriate diet and drugs, it will slowly affect his already built-up arteries. Cardiovascular disease, including coronary heart disease, stroke, and peripheral vascular disease, is one of the major complications of type 2 diabetes, and the development of new strategies to tackle this problem is undoubtedly necessary. An important drug for Todd to have is metformin to treat his high glucose levels. The action not only helps blood glucose levels, but affects lipid metabolism by reducing total cholesterol, low-density lipoproteins, cholesterol and triglycerides. A big contraindication for TOD if given metformin would be a risk of lactic acidosis, and it may be increased if given with alcohol or diuretics, in cases of renal impairment or doses bigger than 2 grams per day. This is a concern considering TOD has hypertension and is most likely he will be on some sort of diuretic, so it's vital that the bloods are regularly taken and acid levels are monitored. Also considering TOD is a heavy drinker, it is important he stays away from alcohol as it can affect and delay the effects of metformin. Nursing considerations for TOD's specific condition would be monitoring his renal function before starting and multiple times throughout, considering he has a slight renal impairment. Monitoring of cardiovascular and liver function, making sure TOD understands the importance of diet control and about the drug aspirin. Considering TOD has plaque formation in his arteries, it is very important that when the plaque ruptures, clots are not formed on the site of the rupture. If clots do form, they could break off and block the arteries, eventually causing a myocardial infarction. Only recently have cardiologists concluded that myocardial infarction is caused by platelet-rich thrombi that form at the site of rupture or fissure of atherosclerosis plaque. Therefore, a medication TOD will be on is aspirin. Aspirin reduces the risk of heart attacks and strokes by preventing blood clots from forming on the surface of ruptured atherosclerosis plaque. Interactions of aspirin that need to be aware when giving TOD would be making sure he's on no other anticoagulant or antiplatelet, as this would cause a huge increased risk of bleeding, especially because of TOD's old age. Nursing considerations, which we need to monitor when giving TOD aspirin, is monitoring platelet count before and during aspirin administration. IV access for TOD should only be at sites that can be compressed, and analgesia may be required for his back/groin pain.
The first one we've chosen is observation and vital signs. We need to assess the blood pressure and heart rate to assess if TOD is in any immediate danger. And if his heart's working too hard, it would result in higher readings. And if the cardiac muscle is starting to die, it would result in decreased values. Abnormal readings would alert the nurse to a patient's deterioration and would enable them to get more assistance from doctors and specialists. We would assess respiratory rate and oxygen saturation, as when the body is not receiving adequate oxygen supply, the brain tells us to increase our respiratory rate. As oxygen saturation below 93% would require oxygen therapy, it's important to monitor these factors. We would also monitor for change, so when he first comes into emergency, to observations being done an hour later to assess for any deterioration or improvement in his condition. We also wanted to monitor the impact of the medications being administered. An ECG is the process of recording the electrical activity of the heart. It can be used for either a baseline, which is used in comparison for future tests, during chest pain to rule out a myocardial infarction, try and ascertain the cause of the pain and which part of the heart might be causing it, and the potential implications and treatment options to reduce the pain. It can also be done immediately following chest pain. As a nurse, we do an ECG to rule out a myocardial infarction and assess whether TOD is having heart-related chest pain, as not all chest pain is related to the heart and may be due to GI issues, as he is on aspirin. In this case, we may be able to simply get the drug order for a proton pump inhibitor to reduce his discomfort. TOD's ECG may show an abnormal repolarization, a previous myocardial infarction. These are both signs of coronary artery disease.
Oxygen therapy. Before using oxygen therapy, the nurse should perform a respiratory assessment. Changes in respiratory function is an extremely sensitive indicator of patient deterioration. By performing a systematic respiratory assessment before applying oxygen therapy, it will significantly improve patient outcomes. The provision of supplemental oxygen is a common practice in healthcare facilities, and therefore the administration, safe implementation and appropriate monitoring are essential skills that all healthcare professionals should have. This type of therapy essentially refers to the administration of oxygen at concentrations greater than that in ambient air with the intention of treating or preventing particular symptoms of hypoxia. In addition to this, the goal of using this form of therapy is to also decrease breathing and myocardial work. In regards to this particular patient, it is evident that he is symptomatic to respiratory problems due to the fact that he is experiencing shortness of breath and increased heart rate and blood pressure, along with restlessness. In Todd's case, due to the fact that he is experiencing shortness of breath on ambulation, it immediately indicates that it would be appropriate to equip him with a low-flow system which will supplement his tidal volume. In terms of which type of oxygen delivery device to use, a nasal cannula should be used. They are non-invasive and easily tolerated by the patient. In terms of the flow rate, nasal prongs should only be set between 2 to 4 litres per minute. If a patient requires more oxygen, the oxygen delivery device will need to be changed. The nurse is responsible for monitoring oxygen saturation by pulse oximetry, and if the patient begins to show signs of deterioration, they should immediately request an urgent medical review by a doctor.
Another nursing management would be taking blood. Considering Todd has had his pain constantly for 24 hours and for 2 weeks on exertion, his heart could already have some damage to its muscle cells, and taking blood from Todd will make nurses and doctors can confirm if Todd has some kind of infarction already by testing his troponin levels. In the presence of symptoms of myocardial ischemia, the diagnosis of myocardial infarction requires detection of a rise and or fall of cardiac biomarkers, preferably troponin, with at least one value above the 99th percentile of the upper reference limit. If Todd has high troponin levels, it means that the heart has had some damage to it already, and the troponin protein has gone into the blood where it should not be. By also taking Todd's blood, we can send it off to pathology that day and get information needed about Todd's condition, such as finding out his cholesterol levels and his levels of high and low density lipoproteins, as well as triglycerides. This is important as we need to determine what is causing Todd's chest pain. If he does have a high cholesterol count, coronary artery disease will most likely be what is causing his discomfort, and we can then go on to providing medication and care for his known condition. Education will be a major intervention for Todd. Much new information has been obtained about the conventional risk factors which have markedly improved prevention and management of the disease. Considering there is a huge amount of risk factors for coronary artery disease, it is important nurses educate Todd about these risk factors which can decline his disease state. Nurses need to let Todd know the importance of exercise in managing his disease, letting him know exercise will bring down his weight, along with healthy eating and up-to-date administration of drugs, will help remove elevated lipids and manage his disease than if he was to continue the way he was going. Not only should nurses educate Todd on when to take his medication, but explain to him what each one does and the side effects which may occur from taking them. Most of importance is letting Todd know about the disease itself, what is causing the blockage of blood and therefore the pain in his chest, and letting Todd know the potential complications if plaque buildup gets out of control. Giving Todd this information means he knows how serious this disease can be, and he now has the power to change what is causing his discomfort and alter his lifestyle to help manage his disease in the best way possible. Researchers have demonstrated that patients who are empowered are more likely to be active participants in the management of their disorder, which should increase their capacity and motivation to take and adhere to the treatment.
Dietitian referral. An important aspect of the nurse's role in terms of food intake is making sure that the patient is referred to a dietitian if it is considered to be appropriate. On admission, the nurse should acknowledge that Todd has hyperlipidemia, type 2 diabetes mellitus, and suspected coronary artery disease. This immediately suggests that he requires a referral in order to develop a meal plan. Research suggests that appropriate nutrition is crucial in terms of achieving optimal recovery. Over the years, specific diets for coronary artery disease have been developed and modified but have generally always involved the reduction in dietary intake of saturated fats and cholesterol. In terms of cholesterol reduction, it is most sufficiently achieved through replacing saturated fats with polyunsaturated fats. Even though it is a dietitian who devises the meals, it is important for the nurse to observe what the patient is eating and to encourage them to continue with the diet. This is extremely important.
So when considering administering medication, we need to consider the safety end. This intervention is to ensure competent clinicians safely prescribe, dispense and administer appropriate medicines to informed patients and carers. The cost of adverse events to individual patients and the healthcare system is significant.
Standard 8. Preventing and managing pressure injuries. The intention of this standard is to prevent patients from developing pressure injuries and effectively managing pressure injuries when they do occur. In events of illness, many patients continuously lie in bed, limiting their movement and positions of which they lie.
Standard 9. Recognising and responding to clinical deterioration in acute healthcare. The intention of this particular standard is to ensure that healthcare professionals respond to signs of patient deterioration and take appropriate action. Events such as unexpected cardiac death often show observable physiological and clinical abnormalities.